Welcome to Nutrition and the Living Donor. My name is Natalie, and I'm the dietitian with the UC Irvine transplant team. The objectives today is to review the nutrition evaluation process, explore candidacy issues, review suggested nutrition education after donation, and to explore opportunities for nutrition intervention in living donation. I will be sharing 2 case studies. Just as a disclaimer, to protect the confidential patient information, names, dates, and other potential identifying information has been changed. The first case study is Mr. Kent. Mr. Kent is a 65-year-old male with no pertinent past medical history. His supplements are listed. He is on a protein shake. His height 5'9", weight 192 pounds, BMI of 28. His labs were within normal limits, his lipids and his blood sugars. This gentleman exercises 4 times a week for 1.5 hours, walks 3 miles per day for about an hour, and his intake includes plant-based proteins, protein shake, and an animal protein. So for Mr. Kent, what do you think his calorie and protein needs are after donation? Does Mr. Kent need to modify his diet or supplement use? The second case study is Brenda. Brenda has no pertinent past medical history. Came in with a height of 5'4", weight 155 pounds. Initially came to evaluation at 170 pounds a year ago and has lost 15 pounds by diet modifications. She is not on any type of GLP-1 agent, no pertinent medications. A1C was 5.5. Her glucose tolerance test was 215. Per committee discussion, patient is to return in 6 months to improve her glucose tolerance test to less than 140. Patient exercises every day for 30 minutes to an hour. Patient includes 2 meals per day. The first meal was fast food salad. The second meal was the chips with a layered dip. For Brenda, what would be her nutrition plan of care to improve glucose levels? Is Brenda a candidate for donation? Taking a step back, we're going to look at evaluating a nutrition donor. Looking at the nutrition care process as adapted from the Academy of Nutrition and Dietetics, there are 4 domains in evaluating a donor. First would be the food nutrition related history. That would entail obtaining a 24-hour dietary recall or a typical intake. I ask about exercise and activity habits and just review the functional status or the Karnofsky score from the physician note. Anthropometrics is also used. I look at measured height and weight. I look at weight trends as available in EPIC and just asking patients about their weight trends. If able, and the consultation is in person, I'm able to get a waist circumference and nutrition-focused physical exams only as needed. Biochemical data and medical test procedures are also reviewed. I particularly look at A1C and lipid panels, and I review glucose tolerance tests. Nutrition-focused physical findings can also be helpful. Other concerns that I look at are any history of GI concerns. Nutrition-focused physical exams are done only if the patient has a concern for malnutrition. Issues that may affect candidacy. For our program, the BMI cutoff is 33, so obesity would be 1. High blood pressure, the risk of diabetes or prediabetes, and malnutrition. Some benefits of nutrition intervention in the living donor. Dietitians can intervene by helping to lower the risk for diabetes, obesity, and hypertension after donation. improve nutrition education and food choices to maintain a healthy lifestyle. Dietitians incorporate motivational interviewing to facilitate behavior change where the patients themselves recognize what their goals is, what they can do to help improve their food choices. Dietitians can help patients incorporate lifestyle, cultural, and food availability choices into nutrition plan of care. Dietitians can also speak with patients as appropriate for patients to use fitness apps where patients themselves can track their own calorie intake and exercise. Donors are encouraged to follow a Mediterranean-based diet, which consists of including whole grain breads and cereals, fiber-rich foods, including lean protein such as fish, lean red meat, chicken without skin, and eggs, including plant-based proteins, nuts, legumes, beans, tofu as examples. Our patients are asked to lower their salt intake so they can incorporate herbs and spices in cooking, including healthy fats in their diet, and of course, fresh fruits and vegetables. For protein needs, we ask our patients to follow the recommended dietary allowance of 0.8 to 1 grams of protein per kilo. Bodybuilders or athletes, and these are people that I consider that would work out for 1 to 2 hours per day, where they have hours of a workout. Their protein needs may be a little higher than the RDA. We also ask our patients to avoid protein-focused diets and excessive protein supplementation. Heart-healthy fats would include monounsaturated fats found in olives, avocado, canola oil, peanut oil, nuts, and seeds. Polyunsaturated fat found in sunflower, sesame, and safflower seeds and oils. Omega-3 fatty acids found in salmon, mackerel, and tuna. The general recommendations for total fat is 20 to 35% or less of daily calories, with 10% or less being from saturated fat. We ask our donors to be careful with excessive sodium in their diet. So we ask our patients to limit processed foods and meats, include low sodium seasonings in cooking, such as thyme, oregano, basil, garlic, ginger, parsley, dill, and chili powder as examples. When eating out, ask for sauces and dressings on the side. The recommendation for the American Heart Association is about 2,300 milligrams per day of sodium. For hydration and fluid, the general recommendation is 1 milliliter per calorie needs, or 8 to 10 cups of fluid per day. Fluid does include water, beverages, soups, and other foods liquid at room temperature, but we do ask that the majority of the fluid intake is water. Other tips for our donors is to maintain an active lifestyle, utilize fitness apps as appropriate to keep track of exercise and calorie intake, maintain a healthy weight, and to limit alcohol use. The current recommendation in literature is for people to aim for 150 minutes per week of moderate intensity exercise or 75 minutes per week on vigorous aerobic activity. You want to try and stay active 5 days per week. Basically, this translates for moderate intensity of 30 minutes 5 times a week or 20 minutes per day 7 times a week. So the first case study is Mr. Kent. Remember, he's a 65-year-old male with no pertinent past medical history. He takes a variety of nutrition supplements, and one is the protein shake. He exercises 4 times a week for 1.5 hours and then walks every day for about an hour. And his intake, he includes plant-based proteins, his protein shake, and his only animal protein is fish. So what is Mr. Kent's calorie and protein needs after donation? Does Kent need to modify his diet or supplements for donation? Because of Mr. Kent's high activity level, I did estimate his protein needs at 85 to 105 grams of protein per day, and his non-exercise days would be 70 to 85 grams of protein. So Mr. Kent was educated on including 70 to 85 grams of protein. Um, in the evaluation process, that he had concerns about losing muscle mass with age. That's the reason for his exercise and the reason for including the protein. So one thing that we talked about was just doing the 15 grams of protein supplement on days that he works out to keep up with his protein needs. I did caution the patient that our nephrologists do follow up on our donors. So if any changes in the creatinine clearance, or if there's any issues moving forward, that the supplement may need to be adjusted or stopped. As for his vitamin D supplement and his other supplements, I recommended he continue to work with his primary care physician, as his vitamin D levels will need to be monitored. And this is Miss Brenda, who already lost 15 pounds in a year, came back to evaluation, and the 2-hour glucose tolerance test was high. So we in selection committee had concerns about that. So we asked to give her more time to improve the levels. So for Miss Brenda, what would be her nutrition plan of care to improve glucose levels? Is Brenda a candidate for donation? For my plan, first and foremost, I praise Brenda for her weight loss accomplishments. She was able to lose about 15 pounds in a year and be able to keep it off for donation preparedness. We did discuss inclusion of fiber-rich foods. We talked about the eating out and including fast food because of her job and requiring a lot of traveling. She does eat out a lot. So we talked about eating out strategies. We even talked about where she can to keep food in a cooler so she's able to have healthier options. In the follow-up, she was able to improve her glucose tolerance from 215 to 138. Her A1C remained stable. Her weight, it just stayed down to about 155 to 156 pounds. She continued to exercise, and she does include 2 meals per day because of her busy lifestyle. And yes, Brenda was a candidate and successfully donated her kidney. There are many opportunities for dietitians in living donation. Currently, there is no established practice guidelines for nutrition care of living donors, so it opens opportunities for more research, publication. The second is dietitians have a unique opportunity to help reduce the risk of diabetes, high blood pressure, and weight gain in this population. Dietitians are able to collaborate findings with the multidisciplinary team members to promote candidacy preparedness and help increase opportunities for living donation. Here are some resources about the Mediterranean diet, exercise recommendations from the Centers for Disease Control, and the nutrition care process from the Academy of Nutrition and Dietetics. These are references that I used in preparing this presentation. They are excellent reads. I encourage everyone, if you can, to look them up and review these articles. But this concludes my presentation. Thank you very much for your time.